Next up, we have Meg Everett, Senior Policy Analyst from LeadingAge, New York.
Hi there.
Good morning.
Good morning, Assemblymember Kim. Thank you for having me. My name is Meg Everett. I'm the Home and Community-Based Services Policy Analyst at LeadingAge, New York. LeadingAge, New York represents approximately 400 not-for-profit and public providers of long-term and post-acute care, aging services, and senior housing. I am also the Executive Director of the Adult Day Healthcare Council, which is an affiliate of LeadingAge New York, and we represent for-profit and not-for-profit medical model adult day healthcare programs across the state. Thank you for the opportunity to testify. LeadingAge New York members provide the full breadth of services on the long-term care continuum. Many of these are Medicaid services. With that said, we believe it's vitally important that the state ensure there's quality home and community-based care available for non-Medicaid individuals so they can age in place in their own homes and in their communities. As the aging population grows, so does the urgency to invest in services to keep this population as independent and as well as possible. New York has created many effective programs to support older adults in the community, but the state is at risk of reneging on the promise of these programs due to workforce shortages and insufficient capacity. So without an adequate system of these supports and services, we'll see more people needing more intensive and costly care in more intensive and costly settings. So we need to build an aging services system support so that we don't overwhelm the Medicaid system, which we know is already underfunded and under significant strain. So the major challenge before us is workforce. We have an elderly population that is exploding and a workforce population that is significantly shrinking. So there are shortages in all sectors right now, including healthcare, but the long-term care sector is suffering shortages that are particularly intractable. Providing care for older adults is extremely demanding, physically demanding, emotionally demanding, requires a lot of grit, and many of the employees that now serve this population are easily moving on to fast food jobs, tourism, hospitality work for commensurate wages. So we really are at a juncture where making home care and other long-term care positions, they are almost impossible to fill. So we're asking for the legislature to address these challenges with significant investment and multifaceted solutions. We need to address financial and social barriers to attracting workers, and we need to reduce barriers to training, certification, and licensure. So we have a number of recommendations in our testimony, some of which include funding transportation for aides, funding job-related supports for trainees, nursing students, healthcare personnel, stipends for training, rebuilding our nurse instructor population, which we really desperately need to do, and also focusing on programs that attract workers to this field, including high school apprentice programs. So, you know, without this, we're going to be behind the eight ball. I want to move on to state our support for continued increased funding for CSE and ISIP under NYSOFA. Many of our LICSAs provide services to the counties for these CSE and ISIP programs. We have continued waiting lists, but also, as Becky mentioned earlier, we need to address the home care minimum wage mandate that they are subject to. They were not funded as the Medicaid population was, and I believe LICSAs are currently dropping some of those CSE and ISIP cases because they're not getting that additional funding to pay the home care minimum wage to their aides. I also want to state our support for other models that kind of buttress in-home care, that keep people at home, living at home and in the community. Social adult day programs and adult day medical model programs are day programs that individuals go to, and then at the end of the day, they can return home. This provides a really desperately needed break for caregivers and family members. Social day programs really serve and provide supervision as socialization, whereas adult day healthcare programs really are serving people that are at a nursing home level of care and without this service would be in a nursing home. So I do want to point out that adult day healthcare programs were closed for a full year, ordered by the state to be closed due to COVID. They reopened in April of 2021, and we have 120 actively licensed adult day healthcare programs. Only 50 of those programs are now open. So most of them remain closed. We have 26 counties, including the Bronx, that have no adult day healthcare programs open. Every one of these counties had at least one program or more. So this is a significant provider that needs attention at this time. I also want to voice our support for senior affordable housing and the resident assistance program, which we have proposed. We urge the state to increase its investment in this area and fund a resident assistance program to support tenants of affordable housing, affordable senior housing. So RAs would help low-income residents navigate and connect to home and community-based care and subsidies in their communities. This would help them stay healthy in senior housing, help them age in place, continue to be independent, and out of more costly levels of care for as long as possible. This program has proven to save both Medicare and Medicaid dollars and improve outcomes for seniors, and it actually also postpones entry into the Medicaid system. And in addition to helping offset some of the challenges we're facing on workforce. We also support neighborhood and traditional NORCs, which are of a similar model, where there is a dedicated staff to help individuals age in place in their communities by helping them navigate services and supports, provide counseling to them, wellness programs, everything they need to kind of learn how to live independently and stay in their homes and in the communities. So with that, thank you for the opportunity to testify. We greatly appreciate it.
Thank you so much for your testimony. The social daycare programs that you mentioned in your testimony, these are mostly organizations that are first approved for home care, right? And then they go,
So you might be
explain.
referencing
Adult daycare. It's different than adult daycare centers?
So social day programs are regulated under NYSOFA.
Okay, got it.
Adult medical are more intensive. They're regulated under DOH, and you have to have a
got it.
sponsoring nursing home to provide that program. But they serve both private pay and Medicaid.
Okay, they serve both private pay and Medicaid.
Yep.
Okay. So it's different than adult daycare centers, social daycare. I just want to distinguish.
There are two different settings. One, social adult daycare is far less regulated. They often have volunteer staff, but they do provide socialization, some personal care, supervision. Many of the patients are dementia patients. Adult day healthcare programs are serving people who need skilled services, nursing services, therapy, social work. They receive recreational and socialization activities and therapies while in program.
Yeah. You also spend a significant time on emphasizing the importance of uplifting and protecting the home care workforce for rightful reasons. Wondering if you or your organization have paid any attention to the discrepancy around forced and mandatory arbitration for home care workers. Because it's not, depending on where they work and under which contract, collective agreement that they've agreed to, some workers are subjected to private forced arbitration to settle any kind of worker-related disputes versus other workers or do not have that kind of a mandate. Thereby, some of the workers, when they do feel like there's abuse, wage theft, etc., their right to recourse is often taken away, and they do not have access to the courts as a worker who may not have signed that forced arbitration clause. So this is a topic that we're ongoing, and it's ongoing. We're investigating now because even within certain labor groups, most labor organizations that try to represent the workers are adamantly against imposing mandatory arbitration for the reasons that I just outlined. But many immigrant minority workers in urban settings have signed this unknowingly at times, this clause, thereby when there's a conflict, they lose their access to the courtrooms. And so I'm bringing this up because to improve the workforce, I think it's critically important that we strengthen the rights of the home care workers, not take away their rights. Because as much as this may sound complicated and illegal, the workers are shrewd and smart, and they understand when their rights are taken away in their industry. So hopefully we can wrap our head around this and come up with a solution moving forward.
We're happy to have discussions with you on that issue, and our workforce to our membership are the critical way to deliver care. And in today's market, we need to do everything we can to support the employees of our organizations and make sure they stay with us and are supported and all moving in the same direction, putting patients first and foremost. And we're happy to have conversations with you about that subject.
Great. Thank you so much for your testimony.
Sure.